Hi, good morning. Very good morning. 30 attempts. Why? You just started streaming at 5:12 a.m. Anyways, a very good morning. So today we're having a live session on image-based questions, right? So let me just try. If at all I project this way, yeah, and this seems to be fine. Okay, so I'm just trying. Like, how should be the orientation? Yeah, I think this will be fine. Perfect. Yeah, hi. Good morning. Good morning, Regina, Tileli, Swapnil, Ramesh, Ashina. Hi. A very good morning, all of you. Hi, Abhishek. When is it streaming live? Okay, fine. Right. So we'll start with image-based questions, right? So I've selected few images, and then see we'll just have the display of the question, and then we'll have a discussion pertaining to that question, right? Hi, Pritika. Very good morning. Right. So we'll start off with our first question. So it's already 5:20. Yeah. Is it clear for you if I'm projecting it this way? Yeah. So, what does this representation or schematic representation give an indication of? What kind of occlusion does this image represent? Hi, Shelly. So, the following image represents which type of occlusion? If you want me to give me options, is it class 1, class 2, class 3, or class 1 or class 2 subdivision 1? Yeah. See, there are certain important points, right? So we started with this basic question, right? So as you can see here, this is the upper arch and this is the lower arch, right? So the mesiobuccal cusp, the triangular ridge of, the triangular ridge of the upper mesiobuccal cusp coincides with the buccal groove of the lower first molar, right? So that is Engel's class 1 malocclusion. And also if you observe here, upper maxillary canine, right? So maxillary canine is present in between mandibular canine and mandibular first premolar, right? And as we discussed yesterday, class 1 malocclusion is present in almost 70% of the patients, right? So based on the general observation, it's present almost in 70% of the patients. So coming to other relevant points pertaining to class 1 malocclusion. So as I said, triangular ridge of upper first molar coincides with a buccal groove, right? And also maxillary centrals overlap mandibular centrals or their counterparts, right? And the profile of the patient with class 1 malocclusion will be more or less orthognathic or a straight profile. So the facial profile is straight in such patients, right? So that's our first question. So we'll proceed with the second one. Just give me a second, I'll increase the timeout of the screen also. Displaying brightness. Never. Okay. Yeah. So we'll proceed with the second one. Yeah. So what does the following image represent? So what is the device the patient is wearing? Is it a functional appliance? Is it a cervical headgear? straight or high pull headgear or reverse pull headgear. So we have different types of headgears, right? So what kind of instrument or device is the patient wearing? So as you can see, we have an intraoral appliance as well as an extraoral appliance, right? Isn't it? So we have an intraoral appliance. We can see face bow here. Also we have this strap. So what does this represent? Yeah, we headgear. That's a general term. I mean, we have different types of headgear, right? So is it straight or cervical pull headgear, or is it high pull headgear, or is it a reverse pull headgear? Hi Viral, good morning. Yeah, as you can see here, so headgear, it's a mainly extraoral device for having, as we discussed yesterday, for additional anchorage and also for traction, right? To exert forces, mainly to control the growth of maxilla and also helps in distalizing the maxillary teeth, especially maxillary molars and also helps in anchorage, right? So as you can see, this is high pull headgear, right? So high pull headgear, we have the parts like head cap and attach it to teeth via a face bow. As you can see here, we have a face bow also, right? So this is high pull headgear. So in fact, the patient is wearing a high pull headgear which is attached to a functional appliance, right? So the treatment, it's mainly used in treatment of, as we discussed, we had discussion of these recorded videos, and I posted in e-classes also, that we have a relation between the vertical height of the face and anterior-posterior positioning of jaw. In other words, longer the face, greater the tendency for the patient to have class 2 malocclusion, right? And shorter the vertical height or shorter the face in terms of vertical height, the greater the tendency for the patient to have this class 3 malocclusion, right? So that's very important. So I'll just repeat, this is very important. Longer the face, the patient will have a greater chance of incidence of having class 2 malocclusion with open bite. Shorter the face, vice versa, class 3 malocclusion, and there can be a deep bite as given in the literature, right? So I covered the same in yesterday's video also, right? So it's mainly used, high pull headgear is mainly used in treatment of long face, that is skeletal open bite, right? Skeletal open bite, class 2. So this high pull headgear, it provides a vertically directed extraoral force which is essential or necessary to modify the growth of maxilla and for distalizing molars, right? So along with this high pull headgear, as you can see in the oral cavity, we have this face bow, and attached to the face bow intraorally is an appliance, like we can use a functional appliance like bite block, etc., right? So that's pertaining to the second image, right? So we'll proceed with the third one. So in fact, we have one question, one image-based question in the recently concluded AAPG 2015, I reckon, where they're given a hand instrument which is used for placing orthodontic brackets, right? It's given in previous multiple choice question books also. So orthodontic band bracket placer, right? We have that hand instrument that's given as an image-based question 2 years or 1 year ago. Now, similarly, we have another image here. I mean, this is not for placing brackets, but what is the purpose of these instruments? So, can you identify that? Let me just zoom in. So this is a third question for today. So what does this image represent? So can you name these instruments? You can see stainless steel bands here, bands. So you have handles, and also you have at the working portion a slot available for holding orthodontic bands. So what are these instruments? So can you guess? More or less they look like forceps, right? So what does this represent? Any guesses? No one is willing to guess. So in the meantime, I'll just post answers for the previous one so that others who are joining us late will have an idea on what we're discussing today. As you can see, we have orthodontic bands, right? Elastics are different, isn't it? Isn't that logical, Abhishek? So, by the way, I didn't give you options, right? So, if I give you options, the answer would be inevitable. So, it's not okay. Band placer instruments, anyways, good try. So, band forming pliers, they are pliers, orthodontic pliers, which are for band forming so that we can adjust the circumference and tighten them accordingly around the tooth, right? So the image represents band forming pliers. So these are band forming pliers. As you can see here. So these band forming pliers stretch band material for a tight fit around the teeth. Okay, right. So what does this image represent? Which appliance does it represent? Just decrease the brightness. Yeah. I think I should still increase the brightness. I'm sorry. Yeah. Okay. So what does the image represent? Okay, let me give you options then. Arch wire or edgewise appliance or Bexaplanes, or none of the above. So what does the following image represent? Archwire, edgewise, bexaplanes, or none of the above. So maybe that's the reason why you are not answering, because in the previous question also I haven't given you options, right? See, when I was in my plus two, my teacher used to say, like, he used to mock us, saying that, see, a time will come where when you ask any person or any student his or her name, they'll say, give me options. So we are so used to these multiple choice questions at the plus 2 level and also at the PG level that we often don't answer if options are not provided, isn't it? Edgewise is something where we don't have this vertical slot, as Ramesh has mentioned here. As you can see here, we have a vertical slot directed occlusally. So this is arch wire or ribbons, or we call this as a ribbon arch, angles ribbon arch. So this forms the basis on which edgewise has been devised, and also bexaplanes is based. So we'll discuss those also. So we have a vertical slot here. Can you see? Yeah. So this image represents angles ribbon arch appliance. Angles ribbon arch appliance. And to discuss few important relevant points, just observe this bracket. We have this vertical slot which is directed occlusally, right? Yeah. Now we'll have some discussion. So angles ribbon arch appliance introduced about 1910. It's well adapted to bring teeth into alignment, but the drawback of this ribbon arch appliance is it is too flexible to bring about the uprighting or adjusting the position of roots. So that's a major drawback this appliance had at the time of its introduction, right? So it's well adapted to bring teeth into alignment, but was too flexible to allow precise positioning of roots. So to overcome this, we had this edgewise appliance, which we'll discuss again later. So a ribbon arch of 10 into 20 gold wire placed in slots and is held with pins. The resiliency of ribbon arch wire simply did not allow the generation of torque or moments necessary to torque roots to new position. So that's a drawback. Coming to the drawback of angles ribbon arch. So that's the ribbon arch appliance for you, right? Voice not audible? I mean, if possible, can you just increase the volume of your device, because I'm talking at the normal pace compared to like every live session I speak at the same pace and same volume. I mean, am I audible now? Am I audible now? Okay. Okay, fine. Hina, if possible, try to increase the volume of your device just and check out your volume output also. Because today we're not having any external disturbances. Yeah. So can you identify what kind of appliance is this? Is it again arch wire or edgewise or Beggs appliance or none of the above? So what does the following image represent? Angles ribbon arch, or is it edgewise, or is it Beggs appliance? I mean, this picture is similar to the one which the modern day orthodontics is based upon. So we have also one multiple choice question pertaining to the same, right? So the modern orthodontics It's mainly based on the basic principles laid down by Angle while designing edgewise appliance. So as you can see here, we have rectangular slots, right? Rectangular slots incorporating a rectangular wire. So this rectangular wire and rectangular slots dimensions are 0.028 and 0.020. Dimensions of the rectangular slot 0.028 inch in inches and 0.020. I mean it's 0.028 and 0.022 inch. So that's the dimension of this rectangular slot. And edgewise appliance incorporates a rectangular wire, a wire cross section rectangular wire, right? So as you can see in the previous image, we have this vertical slot, or we have a slot which is oriented vertically, right? Isn't it? And the opening is present occlusally. But here, in case of edgewise, the slot is oriented at the horizontal level, right? So the slot is present horizontally, right? And why do you call this appliance as edgewise? It's because in case of this ribbon arch appliance, as you can see, we have a slot, upper opening, right? So the wire is placed from the top, like this, from the top, because of the slot position. But in case of edgewise, because the slot is present here, oriented horizontally, the wire is placed in this direction, right? So in this direction. So the direction of placement of wire is 90 degrees compared to its orientation in ribbon arch appliance, right? So hence it's called as edgewise appliance. Okay. So this is Angle's edgewise appliance. So arch wire is inserted at a 90 degrees angle. As you can see, arch wire is inserted at 90 degree angle to plane of insertion of ribbon arch, right? Hence it is called as edgewise. Rectangular wire is tied into rectangular slot with ligature wires, and dimensions of slot are 0.022 inch and 0.028 inch, right? Just make a note of these points. Okay. Yeah. So that's pertaining to edgewise appliance. And then since we have discussed about this Angle's arch wire or ribbon arch and edgewise appliance, we'll just conclude the same by completing this. So what does the following image represent? Is it E-arch, pin and tube, or edgewise, or Beggs appliance? So what could be the appropriate option? E-arch, designed again by Angle, or is it pin and tube appliance, or edgewise appliance, or Beggs appliance? So let me just zoom in. So again we have slots or brackets which are oriented vertically, right? Which are oriented vertically. So you say pin and tube because you feel like you're seeing a tube-like structure. Yeah, so this is Beggs appliance, by the way. So Beggs appliance, it's based on the design principle of a ribbon arch appliance or ribbon arch attachment of Angle, right? So the difference between the ribbon arch and Begg is that we have mainly few differences, and one of them is the placement or orientation of vertical slots. The vertical slots are present, however, the opening or the pin is oriented gingivally. It's occlusal in case of this ribbon arch, but it is gingival in case of Beggs appliance. So Begg appliance is modification of, by the way, Begg, Tweed, they're all students of Angle, right? So Begg appliance is a modification of ribbon arch attachment into which round arch wires are pinned. Ribbon arch bracket turned upside down so that bracket slot is pointed gingivally. So that's the difference between ribbon arch bracket and beg appliance. Okay. Yeah. And finally, we have the last one for today. So what does this image represent? No options this time. We'll see how far you can guess. So what does the following image represent? Hi Bernice. Hi Tanu Singh. Hello. So is it lip bumper? Frankel's appliance is tissue-borne functional appliance. It appears like Frankel. Okay. Now? Yeah, the following image represents lip pads. Lip pads, which is a component of a functional appliance. Yeah, the lip pads made of acrylic. So lip pads are components of functional appliance. Their function or their objective is to hold the lips away from the teeth, right? So they hold the lips away from the teeth and force lips to stretch to form oral seal. So these are lip pads. Okay. Yeah. So just make a note of this important point. So lip pads, they are components of functional appliance. They hold lips away from the teeth, improve the tonicity of the muzzle, right, and also improve the oral seal. They are positioned low in the vestibule and must have proper inclination to avoid soft tissue irritation. And as I said, they improve the tonicity of lips and promote soft tissue remodeling, right? So these are lip pads. So far we have discussed a few image-based questions. So the first one which we discussed is angles class. And again, we'll just have a brief summary of all the images which we have projected in this live session, right? So the orientation of occlusion in this schematic representation, it is angles class 1. Normal occlusion, right? So mesobuccal cusp in the buccal groove. Lip bumper again, as such I feel there is a difference in the functionality. Anyways, I'll just refer once. Because lip bumper, it has a specific function. I'll just get back to you, Bernice. Yeah. So this is angles class 1 malocclusion, right? So similarly, you can have image-based questions pertaining to angles class 2 subdivisions or even class 3 or class 3 subdivision, right? And this image represents extraoral appliance, right? Headgear, high pull headgear with functional appliance. So high pull headgear. And then we have this band forming pliers. So these are pliers which help in forming bands, orthodontic bands. They can be, their diameter can be controlled so that we can tighten them accordingly around the circumference of tooth. So these are band forming pliers. So and then we have this angles ribbon arch appliance with a vertical slot, right? So angles ribbon arch. And then we have edgewise appliance. So edgewise appliance with rectangular slots and rectangular wire, right? And we have Beggs appliance, vertically directed slots. And finally, lip pads. So lip bumper, I'm just referring it. Anyways, I'll just go through the textbook also. It's mainly used for correcting the lower molar teeth, for holding or for correcting the lower adult molar teeth. So the lip bumper is mainly used for, it's mainly designed to gain space and make room for lower teeth. So this mainly corrects the pressure that's being applied by the soft tissue. Even the lip sucking habit, lower lip sucking habit can also be prevented by using this lip bumper. Okay, we have this Angles Orthodontist website. Okay, yeah. Not only maintains space, as per the literature, it helps in disclosing, creates space used for correcting the crowding. Yes, they are components of Frankel. Yes, we have this tissue-borne appliance, Frankels. Yes, lip pads. They're all functional components of. They're secondary components of Frankel. We still have a lot many image-based questions, but due to time constraints, I couldn't really prepare. Anyways, we're going to have more recorded videos on these image-based questions also, right? It's not, yeah, it's it transfer hypertonic. I mean, it decreases the pressure from the soft tissue, right? So hypertonic, from the hypertonic muscle force to transferred molar, yeah, helps in disclosing. Yes, Abhishek. Right, so this is the format which we tried. So this is the first time, I mean maybe second time I reckon, or first time. Or by the way, this is the first time we tried our image based question in this session. I mean, if you feel like it's fine and okay, we'll incorporate more image based questions every week, at least one live session. Yeah, yes, hypertonic. So as we have been planning Thursday and Friday morning live sessions, so if you feel like it's okay and if it is useful for you, then we'll incorporate this image-based question format in one of the live sessions. What do you say? So this is apart from the recorded videos. Recorded videos will be having image-based questions. So we're talking exclusively about live sessions. Ashina, you're live. I thought you were sleeping. Hi, Vanilla. Yeah. I mean, if you feel like this format is fine, or do you want me to frame a question? Because, see, I show you some image, and do you want me to ask a question like a question? I mean, obviously, I'll be asking a question, but do you want me to give you the options also? or shall we just proceed with the description of the image, because it saves time and then we can proceed and we can cover up many image based questions possible, because hardly we covered few 7 image based questions now within 20 minutes, so within 20-25 minutes. So we can in fact cover more image based questions, maybe 10 to 15. Yeah. See, it's you say again, you say wake up, guys. It's really tough. But what time do we sleep? I mean, it all depends on what time we sleep. So sleep at 10, 10:30, then it will not be a Herculean task for us to wake up at 5 o'clock or 4:45 or 5 o'clock. But if you sleep at 11:30, 12, 12:30, 1:30 or 2, then it's terrible. It's like hell waking up early. Anyways, I'm just waiting for our regular schedule to just get completed. We'll be completing that in another. Uh, Next we have. So this week, although perio and complete, we still have 2 more weeks. Once we complete our regular schedule, then we can have live sessions every day, every morning. Yeah. Okay, Pratibha. Right. So any super every morning. Yeah, it's super for those who utilize it. Okay. So anyway, since this is a weekend, by the way, today we'll be having our first discussion in our study club also. So you can just check out. So morning we're planning in such a way that morning session will be having questions, right? We'll just post questions. Our moderators will post questions, and by evening, when all of you respond to those questions and all, then evening we'll start having discussion, right? We'll see how it goes this week, Friday, Saturday and Sunday, and based on that we will proceed in the next week, right? Okay, fine. So I guess we can conclude our session, right? So every week we'll plan image based question, right? So image based question every Friday preferably. Timing, burn is timing as such we're not giving, because already we have restricted the timing of the discussions, right? We're not going to have discussions from Monday to Thursday, right? So Friday, Saturday, Sunday, we aren't really we haven't really fixed any timing. We just want to see this week, right? So this week we'll just try one format. So we assumed, or we had this planning of leaving out or posting questions in the morning or afternoon session, before afternoon session. And by the time you go through the questions and you answer them, right? So us group of members in the study club. So by evening, we'll see how you're answering them. I'm sorry. And based on that, we'll proceed. We'll give you the key and also appropriate explanations and related topic-wise discussions, right? Either in form of text or in form of images or in form of voice notes, right? So we're just planning it. So we'll start it today, right? So as such, no exact timing is being specified for this week. So since we have to incorporate or take into consideration timing of different students, so we'll be opening up the discussion only on weekends from Friday to Sunday. I mean, how many of you agree when I say or how many of you are willing to have a live session on Sunday? not early in the morning, but a live session on Sunday. Vanilla, you're willing? And Sunday, in fact, I'm planning a different one. At least not this Sunday, but I have something in my mind. So we have this, alongside my house, we have this beautiful background. We have some greenery and we have some fields also nearby. And the sunrise fields early in the morning, it's a perfect time to observe nature and to enjoy. So we can plan a general session or we can plan any topic wise discussion also. Because Sunday, I don't know how good it goes. Okay. Anyways, we'll just work on it and we'll get back to you. I'll post that relevant information in our WhatsApp group also, and I'll let you know. I'll update you regarding the same, right? Okay. Tanu Singh, lip bumper. Vinila, drop a mail at proudtobedentist@gmail.com. We'll add you to our WhatsApp update group, right? You'll have regular updates of the events from our academy. Just drop a mail. We'll send you the link to our WhatsApp group. Fine? Yeah, we'll just conclude then. In case you have any queries or doubts, you can drop a mail at proudtobedentist@gmail.com. And Tanu, you have any point to make? I didn't get you. Yeah, then take care. So have a great day ahead and have a great weekend. So Friday, Saturday, as I keep on saying, if you're planning for weekly test, Friday, Saturday should be the time where you need to practice as many multiple choice questions as possible, and there should be some limited time for revision. For example, you're going for rotal path this week, so Saturday at least one session, afternoon session or evening session, dedicate for revision. Go through all the important points which you have been writing down or which you have been preparing, and give demo tests on Saturday itself, right? Demo test on Saturday itself. Daily test you have been giving, right? So daily test you have this comprehensive approach, right? So Saturday try to give off demo test, and Sunday you go for the weekly test. And on Sunday itself we'll update you regarding the next week's schedule, and also we'll add up more videos pertaining to the next week's schedule in your e-classes. And anything uploaded to e-classes or test series will be intimated to you via mail, right? So you need not really get confused, or you need not have that ambiguity, right? So all the things will be updated through mail itself, right? Yeah. Have a great day. Keep smiling. All the best and give your best, right? Take care. Bye.